Hello and welcome. Bienvenue. People are hooking up their audio and joining us. It's great to have you here today, this afternoon, for our CanCOVID speaker series. We are joined by Dr. Steve Hrudey, and he will give his presentation, and then we will have time for questions at the end, as per usual. If you want to keep your monitor on or off, that is fine. You will have a chance to ask questions yourself. You can also put them in the chat box. And so now, without further ado, I'll turn it over to Steve. Steve, take it away.
Thank you, Kimberly. Good afternoon, everyone. So, okay. Just went to start my, there we go, okay. So I'd like to bring everyone's attention to, if you're interested in this subject, there is a previous presentation by Dominic Frigon from McGill, who gave a presentation on June 9th that's in the archive. I won't be covering all the ground that Dominic did. I'll be doing an update on where we are now. So I'm going to talk about the COVID-19 Wastewater Coalition created by the Canadian Water Network, tell you a bit about our expert advisory groups, talk briefly about wastewater surveillance, but not the full background that Dominic provided. We've been running an Interlab methods validation that's we'll be reporting on very shortly. I'm going to show you some wastewater monitoring results that we've got in Canada. I'm going to talk about ethics and communications guidance that I think we're leading the world in having put these out, and then provide you with a summary. So the COVID-19 Wastewater Coalition was created by the Canadian Water Network. Full credit to the CEO of Canadian Water Network, Bernadette Cohen, for bringing this up. The idea was to have something to knit researchers and users and the public health sector together about what's needed and how we might explore wastewater-based epidemiology that could be used to inform public health decision-making during the pandemic. The first step in launching this was to set up an option for researchers and water utilities and public health authority members to sign on to a set of principles. So the map here just shows coalition signatories. At this point, we have 127 who have signed on. Basically, to sign on, all they had to do was adopt the framework that we spelled out. Adopt that the research and activities needed to be framed in terms of end user needs and decision making, commit to open sharing of ideas, and ultimately open sharing of results, subject of course to the ethics guidance that I'm going to talk about at the end. So Bernadette stood up a national research advisory group that's representing members from across Canada, from BC all the way to Halifax. And they provided inputs that allowed us to put up a lot of the framework and to launch things like our Interlab testing. We also saw a need to have a public health advisory group, and in this case, this took us a bit longer to stand up because public health folks tended to be up to their eyeballs with the pandemic itself. So we took advantage of a few retired individuals, and we started the idea here to try and determine what it is that public health decision makers most wanted to learn from wastewater epidemiology. But then we recognized the ethics element and brought a couple of ethicists on board, and I'll talk about that at the end of the session. So this pretty much got off the ground thanks to Gertjan Medema and his colleagues in the Netherlands. They were the first to report success with wastewater monitoring. And this came about largely because they were already doing monitoring for infectious viruses in wastewater for long-term program. And so they had the program in place. They just simply needed to adapt it to detecting the SARS-CoV-2, or at least RNA fragments from the SARS-CoV-2 virus. So this is one of the earlier sets of results from Amsterdam. The orange line here is the genetic signal that they picked up in Amsterdam inlet sewage. The blue line is a indicator of lab-confirmed COVID cases, and the gray line was COVID hospitalizations. As I say, this is for Amsterdam. So this looks pretty promising. They indicated that there's a lot of promise here in that the virus could be detectable. It allowed tracking the COVID cases. In this case, appears to provide up to a week of advance warning. So with that offer of considerable potential, a lot of people have hopped on board, and you know, part of the presentation here today is to point out that there are still a lot of technical questions that remain unanswered that will need to be dealt with. Just as an indication of that, this is another paper from Medema's group. Just shows, you'll notice this is a log-log scale, so the correlation between the gene copies of the virus and cumulative cases in their sampling. And while there's clearly a correlation here that's obviously going to be statistically significant, but the scatter should grab some attention as well. So this is kind of an interesting depiction, and I'll show you the website in the bottom right corner. Some folks in California have been tracking the users of wastewater monitoring for SARS-CoV-2, and little blue indicators here are all the places in the world who have informed that website of their interaction. So you can see that the technique really has proliferated. In my research career, I've never seen anything quite like it, where that much has happened that quickly, which is great in terms of you know, getting a variety of people looking at it. But there's also some cautions that we'd like to bring out. So clearly where all this comes from is that SARS-CoV-2, early on we discovered that it was shed in feces by both asymptomatic and symptomatic people, and it's the asymptomatic people who apparently can cause infections, but being asymptomatic, they're unlikely to have been clinically tested. So this opens the possibility of the early warning. Sewage provides a potentially efficient pooled sample of a community or an institution that provides that sewage. So, you know, rather than having only individual clinical samples, there's the opportunity for a larger sample body. There is evidence initially from the Dutch group, and in some evidence we collected as well, that as few as a few cases per 100,000 can be detected, so the sensitivity is possible. The idea then is to be able to support epidemiology and surveillance and provide potential early warning. The ultimate focus is on trends analysis and perhaps providing early warning for high-risk institutions. So the coalition itself was established to try and validate a consensus sampling and analysis method, identify the capacity and opportunity for doing this in Canada, inform how wastewater epidemiology and surveillance programs could ultimately inform public health decisions. But we've stressed with our participants that bad data is worse than no data, and we encourage our investigators to undersell and over-deliver. Ultimately, we're seeking to foster collaboration and exchange knowledge. And ultimately, we want to be able to identify and encourage promising new approaches rather than just repeating existing activities. So there's still a lot of emerging science and practice here. The application is not just as simple as applying PCR. So lots of researchers at universities are doing PCR. on the health side for clinical sampling, but on the environmental side for environmental sampling, the sewage sampling is much more difficult. There's a processing step that needs to be done and raises questions about where the virus is best going to be detected in the water versus solids. And to maximize the potential that we see for it, rather than just giving a presence absence like you were infected or not, we're looking to try and be quantitative so that you can detect trends. The point is that the wastewater matrix is very challenging, and it makes having effective quality assurance, quality control essential. So we put together a Interlab study, and our participants in that, BC Centers for Disease Control in Vancouver, the University of Alberta and Provincial Public Health Lab here in Edmonton, Alberta, the University of Saskatchewan. The National Microbiology Lab has acted as the center for this and prepared the spiked samples. At the University of Waterloo, University of Windsor, University of Ottawa, and École Polytechnique in Quebec. What we were trying to do was characterize the inter and intra-laboratory variability in using these techniques. We recognize that the biases between protocols are likely to be tied more to how the samples were prepared rather than differences in the qPCR amplification. But you know, with the diversity of protocols, we were trying to leverage the existing experience and capacity in doing this study. It was clear from the beginning, in part because of availability of equipment, and not everybody was funded. In fact, most groups that have been helping here haven't been funded. It's simply not feasible to have a national standard. There's supply chain issues and other complications. We chose to engage a cross-section of public health and research laboratories. We determined that most of the variability is likely to be attributable to the sample preparation step rather than the PCR quantification steps. Most of the approaches currently used in Canada rely on either chemical precipitation or ultracentrifugation processing. Ultimately, we wanted to answer, you know, can these various methods reliably detect and quantify SARS-CoV-2 in wastewater to support establishing trends. What we found in terms of results is that the concentration estimates for known spikes were generally consistent. Spike surrogates are detected in both solids and liquid phases, but phase partitioning is an issue that needs to be addressed. We need to clarify if and how PCR handles inhibition, because it is subject to inhibition from the sewage matrix. We need to clarify how individual labs are doing standard curves when they're interpreting results. The final study report is under review right at this as we speak, and that report will be forthcoming shortly. So we encourage you to watch the Canadian Water Network website. I promised to show some preliminary results from what's happening in Canada. This is for the region of Peel. These results are courtesy of Mark Servos at the University of Waterloo, who has been doing the analyses for Peel region, and they've included these results in their epidemiology update. So the gray mountain in the background are the cases, and the two lines represent monitoring of two different wastewater treatment plants within Peel region. And you can see that there is tracking there. The other result I'll show here is from Ottawa Public Health, and they've shown this on a dashboard that they're maintaining for the City of Ottawa. These results are being provided by a group at the University of Ottawa. And you can see that there's some early warning back here in July and August, but it's not totally consistent. Also mentioned that we're investigating through the coalition and various investigators in the coalition other novel approaches. In this case, the group at the University of Ottawa has been exploring the potential for using protein markers of the SARS virus rather than relying on PCR alone. So the purple line here is the protein marker that they've been evaluating, and it shows some promise. They did have this preprint article that's available for anyone who's more interested in following up. So I mentioned at the outset that we've shown leadership with all of those groups who are doing this around the world. The Ottawan has talked about ethics, but nothing explicit was put out. We recognize that wastewater monitoring for SARS-CoV-2 is really an application of public health surveillance and therefore requires appropriate ethical guidance. We recognize that with our very first principles we put out in May and June. But we brought together that public health group I showed you earlier to actually produce a document. So the purpose, we recognize, if we're out to inform public health decision making to protect public health, ultimately for that to be effective, and we're seeing lots of signals of challenges to that in Canada and around the world, requires public trust. And so a failure to follow ethical guidance can easily lose that trust. There's clearly needs to be a collaboration between investigators and public health decision makers. And a lot of the academic investigators who are pursuing these techniques since this came online haven't necessarily had previous dealings with the public health community and probably are not aware of the ethical obligations that public health decision makers face. Wastewater monitoring clearly has the potential to identify groups of individuals that makes this a sensitive human health related information gathering. Public health surveillance involves balancing individual rights and freedoms with population interests, and therefore requires difficult choices. We sought to articulate what to consider and weigh when making decisions, planning and implementing using the data from wastewater surveillance, and ultimately communicating those findings to the public. So a major breakthrough for us was one of our members on the Public Health Advisory Group had worked in producing a systematic review for the World Health Organization on public health surveillance in general. And so we were able to recruit him to our group, which led us to consulting these WHO guidelines on the ethical issues involved in public health surveillance, which clearly the wastewater sampling has to be considered public health surveillance. We found that 12 out of the 17 guidelines that were in the WHO document applied directly to wastewater surveillance. So our report on this, which is available on our website, simply elaborates the aspects of how how this activity reflects on the guidance that WHO has provided. So we found that explaining that is the way to make this real. And as I mentioned, this guidance is available on the Canadian Water Network website. So it's that web link I just showed. So with that, I'll summarize. The wastewater surveillance for SARS-CoV-2 offers clear promise of providing additional insight for informing public health decisions. There needs to be an emphasis on data quality if we're going to underpin any reliance in wastewater surveillance data. So recall my comment that bad data is worse than no data. Many aspects of wastewater surveillance, the quantitative data need to be clarified and better understood. We're going to be reflecting on that with our Interlab study report, which will be available shortly. And ultimately, the ability of wastewater surveillance to provide effective early warning is a key question that we're attempting to explain to potential users as we gain experience with it. So with that, I'm basically through the talk, and we can entertain questions.
That's excellent. Thank you so much, Dr. Hrudey. Just to summarize some of the conversation that's happening in the chat already, Colleen Naughton from ArcGIS Online Dashboard has shared a link in the chat box there. They also run the Twitter account COVID-19 Poops, if you want to follow them there. And they're making sure that all this information is getting shared, and there's going to be a report at the end of October that they're gonna put on cwn-rce.ca. Vincent Moisier asks, is there any plan to detect other viruses which may be particularly relevant when flu and influenza are coming?
No plans right now for flu and influenza, but the reason, as I mentioned, with the Dutch group was able to get up so quickly is that people have been using this technique for more than a decade. There's been programs for WHO to determine the effectiveness of the inoculation and vaccination programs for polio. So, I mean, I guess an idea that comes to mind is that, hopefully we'll have a vaccine at some point for COVID, and there may be value in this technique for monitoring how that plays out in terms of the population. So others have done a variety of viruses, but we're pretty much filled up our bandwidth right now dealing with the issues around COVID.
Great, thank you so much. And FundMe asks, the University of China in Hong Kong has developed a successful stool test for SARS-CoV-2. Has there been any communication with them as to what methods they use which might help in detecting stool in wastewater?
We haven't had any direct contact. I can't speak for all of the 127 people in our group. There may well have been. I know some of my colleagues at the University of Alberta have been working with Chinese researchers on a number of fronts. So I think the real challenge, of course, is there's just so much stuff coming out for everybody to try and keep up with it is a challenge. I think the key question that needs to be answered, there's been a limited study showing whether infectious SARS-CoV-2 survives in stool and ultimately into sewage. The early indications are that it does not, so that the risk to wastewater workers from sampling wastewater appears to be limited. But verification of that is going to be important. There was a report out of China just last week of where sewage was implicated as having spread the COVID in a dense neighborhood. But looking closer at the report, they were relying primarily on PCR detection of the RNA signals, and that doesn't detect infective virus. It just detects RNA from the virus, which is a very different thing.
Mm-hmm. Great. So Colleen asks, how do you balance ethics guidelines making this information available as a public good and then privacy and data quality concerns? A lot of private companies in the US are sampling wastewater and not making this information available that could be useful for researchers to analyze.
Well, it is a real challenge, and that's why we took it on and put the guidance out there, and we feel pretty comfortable that WHO as a publication source for that guidance is good. What inevitably you find is that all of these guidance or individual guidelines tend to work against each other. There's no black or white, do things one way and not another. Basically, what the ethical guidance tells you is you need to look at these various factors and take them into account and not knowingly blunder into doing bad things. I guess our motivation was we were concerned with the number of people who were starting up to do this kind of work, that there's always a pressure on academics to get their results out and tell the world. And sometimes that can involve reporting it to the media before it's even been reviewed. For this kind of work, we regard that as a bad idea. It's likely to undermine trust. And we recognize that there's enough challenges with data quality that premature release of data without having some consistency is going to be an issue. I should mention in terms of the data quality that not only are we coming out with our report soon, but the Water Research Foundation in Denver funded a major study in the US, retained a contractor and dealt with a large number of labs to do checking on their ability to produce reliable results from sewage. And that report should be coming out shortly as well. We strongly encourage anybody who wants to work in this area to look at those reports.
Great. Peter has a question. What is the status regarding the use of WBE data for pandemic management on a day-to-day basis in Canada and elsewhere?
I would have to say it's not being used to manage the pandemic at this point, because we're still validating that we believe the results from the monitoring. So a number of public health agencies are obviously interested in what this can do for them, and they're working with the investigators to collect and review data. But I think we're a ways away from having the sewage data be a primary determinant for public health decisions. The exception there may be that there's a focus we're involved with of looking at institutions. There's been experience out of the US where universities have monitored on-campus dormitories and picked up early signs of infection and used that as a basis to come in and do clinical testing throughout the population. That kind of approach is being considered now for high-risk institutions like long-term care facilities.
That's great. Juliet thanks you for a great presentation and says, what do you think some of the practical uses of sewage surveillance data for what do you think some of the practical uses of sewage surveillance data for SARS-CoV-2? How do you anticipate decision makers could use the data in comparison to the traditional surveillance tools?
Well, it's never going to replace clinical testing. I think we've tried to be clear about this, that it's not a magic bullet. It's not an alternative to clinical testing in terms of making decisions about individual infectivity. But it's something to expand our ability to understand what's going on. I think retroactively, the kind of data that our various participants are collecting is going to help us understand this pandemic a lot better than would have otherwise been the case. And frankly, a lot of the data that's being reported in the literature right now is a little bit more retroactive, very short-term retroactive, but it's still looking at what's happened rather than necessarily providing this evidence for decision makers to say, let's do something tomorrow. I guess we're getting a strong enough signal about a second or third wave, depending on where you are, that we don't actually need the wastewater evidence to convince us that we're heading into a bad space.
Well, on that note, we're at 4:30, so I want to thank everyone for your questions, and thank you, Bernadette, for the clarifications and posting additional links in the channel. Yeah, and FundMe also had a follow up about the Hong Kong paper that we don't quite have time for, but I want to thank you all for joining us. Thank you, Dr. Steve Hrudey, and if you are interested in furthering the conversation, we do have a wastewater channel on our CanCOVID Slack, where Dominique and others are very good about posting a lot of these articles, because as you mentioned, there's a lot of stuff that comes up and there's a lot of stuff to track. So that's one way you can go for this specifically. Thank you so much, everyone.
Thank you.
Have a good afternoon.